Hi everybody, welcome back. I'm Tina, for those of you who don't know, and I am in the accelerated nursing program at the University of Toronto, and I just finished first year. Woohoo! So one more year to go until I graduate, and I just wanted to come on here and kind of share a little bit about how my first year went, like what kind of courses we had, our clinicals and things like that, since I think there's not a lot of information online about the program, and it's like the first year since COVID that everything is back to normal. So I hope this video is informative for those who are going into the program or for those who are thinking of applying. So yeah, let's get started. So in the fall term, we took 3 courses. We had Introduction to Nursing Practice, Introduction to Nursing Health and Wellness, and Introduction to Discipline and Profession of Nursing. For the Introduction to Nursing Practice course, it's one course, but it's actually consisted of like 3 separate components of the course, I guess you can think of it that way. So we had one component of health assessment. So that class is really like, it builds up of learning how to do your head to toe assessment, which is like a crucial assessment in nursing practice. So you kind of learn a different system each week. So for example, we would do cardiovascular, so your heart the first week, and then the lungs next, and then like your muscular system the next, and then in the end we connect it all together and we have our final exam for that portion of just doing like a head to toe assessment. You're partnered up and you have like another student with you, and you're like doing like a whole assessment from their head all the way down to their toe, like literally. That's basically all it is for the health assessment portion. And then we have the therapeutic skills portion, which is basically your, like, I guess foundational technical skills that you do in nursing. So for example, you have your NG tube care, your IV maintenance care, and then like things like catheter insertion and things like that, where you kind of have the lecture portion. So the professor will talk about how these things work. Then you have your weekly labs where you go into the simulation lab and you work on like mannequins that can breathe and have heartbeats and lung sounds, and it's super cool. And it's a really great experience, and you really get that hands-on practice each week in the simulation lab for that course. And at the end of that course, it is not a technical, like not a hands-on exam, it's just like a written exam with multiple choice and short answer questions. And then we have our third component. It is called relational work, and that is like the portion where you kind of learn about how to communicate with people, just how to be a good nurse in terms of like therapeutic communication with your patients, how to build rapport with families, and just like things like trauma-informed care, and just overall the soft skills of nursing, I would call it. For that portion, we also just had like a written exam, and I think it was all short answer. I don't really remember if there was multiple choice. All right, so that is Introduction to Nursing Practice. My next course that we took was Introduction to Discipline and Professions of Nursing. This was, in my opinion, an easier class. But basically, this class you talked about like the colleges, the associations related to nursing, the rules, the regulations around your scope of practice as a nurse, your responsibility, there's legal issues, ethics of nursing, just things like that. And in the end, we just had like a final exam with short answer and multiple choice sections. And then we go into Introduction to Nursing Health and Wellness. So this course is kind of also split into 2 sections. So we had like the first half from September to like, I guess like mid-October. That was our, we did like older persons, so geriatric setting. And then from mid-October to December, so the rest of the term, we did mental health setting. This course is the course that had clinicals. So we would go to lecture for 3 hours a week, and then we would go to clinicals for 2 8-hour shifts for the older person setting, and then 1 8-hour shift for the mental health setting. Basically, it's really just like a focused study of like how the diseases that are commonly seen in older persons, the issues that you would face when you are in the older person setting, and like really focused on just caring for that population. Same thing as mental health. Mental health is a lot about like suicide risk assessment, all this different type of assessment, and those therapeutic skills that you build from like talking to the patients. And we haven't learned about medication yet, so there wasn't any of that. In terms of clinicals, for both of them, because you can't give medication, you're not like really doing that much, I would say. Like for a lot of the time in the older persons, we were shadowing the personal support workers and we were kind of helping them out. So there were a lot of doing the care for the patients. So you bathe them, you clean them, you help turn them, you help to get them up and walking, transport them, and things like that. So not really something that a registered nurse does, at least not in the hospital that I worked at, because registered nurses are really focused on like giving the medication and doing the assessment. But because we didn't have the skills to do these things, we were more doing the care aspect, if that makes sense. But we did get the opportunity to practice on listening to like lung sounds and heart sounds, especially if our patient had like, let's say like pneumonia, and we were able to listen to the crackles and to identify those things in our older person setting, which I thought it was really cool to be able to get exposure to that. And in terms of mental health, most of the things, because we only had 8 hours a week at the hospital, it's not that much time to really do a lot of things, but we were able to do like the mental status exam, the suicide risk assessment, and just really spend our time talking to the patients, doing some activities. So I was able to like play bingo and like decorate cupcakes with the patients, and that was super fun. And we did a lot of charting, just no medication for the first term. That's basically it. And for the final, so all the clinicals in this program is pass or fail, and it's mostly determined by your clinical instructor. So you have one clinical instructor to a group of like, I think we had like 5 to 7 students. So you can see it's like they're running around. They really can't really pay attention to all of you at the same time, but they really try their best to support each of us individually. And you can always ask them questions whenever you need. So I never felt like I was unsupported in clinicals. Because the clinical instructors were super good at their job, even though we had like 6-7 students. But they basically evaluate you, they write you an evaluation, and then the faculty, so our professors, will take a look at your self-evaluation and then also the clinical instructor's evaluation for you, and determine if you pass or fail this course, the clinical aspect of this course. And then the other aspect of this course is based on grades. So that's like your regular like exam, your written multiple choice short answer, select all that you can apply, select all that apply type of questions, and that determines your actual grade for this class. But yeah, that's basically fall term. I did relatively well in all 3 courses, and I found them to be I personally found them to be very straightforward and very helpful in building your foundational skills in nursing. And I think older persons and mental health were a wonderful place to start your clinical placements, because it's not too overwhelming and you're not running around like acute care, giving meds, doing all these things. And I really enjoyed the first term. I had some wonderful professors. Everything was marked really fairly. Exams were really straightforward. They weren't trying to trick us at all. Yeah, I think that's all I can really say about the first term. And let's move on to the next term. Okay, so for the winter term, we took 4 classes, and that term was super hard for me. It was so overwhelming because the courses were so hard. It was just a lot. Okay, let's just say that it was a lot, and I did not do well. It's kind of like a confusing part of this program. So basically from the winter, so from January till June, you have 3 different rotations. So 3 different clinical placement, and you rotate. And then like the faculty, the program is kind of split into like 3 different groups of people. And so like, for example, I did like labor and delivery first, and then I went into acute care, and then I went into pediatrics. But then my friends would have gone to like pediatrics first, and then labor and delivery, and then acute care. So you have 3 different groups of people rotating between 3 different placements in the same order, just starting at different placements, if that makes sense. Hopefully that makes sense. I had 2 placement in the winter term. One kind of extended into a little bit of the summer term, but my first one, which is Intro to Nursing Care of Childbearing Persons and Families, that's what it's called. That is my first rotation out of the 3, starting in January. And that class is about just like taking care of labor and delivery patients, postpartum patients, antepartum patients, and a little bit about baby stuff, like newborn babies, not really any older, because that's covered in pediatrics. This class was super fun. I found that really interesting, and I did really well. But this is when we started doing nursing care plans. So those like long essays where you identify a nursing diagnosis, so usually something about like pain management, and then you think of like So you provide a rationale why you think this is an important nursing diagnosis or something important issue that you need to take care of or you're prioritizing. And then you think of like 3 interventions that you can do that's not related to like what doctors do. It's like purely what nursing do. So like pain management, you can do like providing ice packs or like providing emotional support, things like that. So something specific to nursing. Yeah, so this course, we were doing clinicals once a week, 12-hour shifts. Really not that bad. I thought 12-hour shifts were gonna be so bad, but I love 12-hour shifts because I get like 3-day long weekends. I love 12 hours. And I think I was able to really stay with the patient for the entire day rather than just doing like halfway and then saying bye-bye and just like passing them on to my nurse who's there for 12 hours. And this way we can really stay with them for the whole shift that the nurse is there for. And I really appreciated that. But then the only thing is that I didn't really get to see any deliveries. I think it's just my group. Like other groups I've heard, like they were all able to see deliveries. It's literally just my group, and we got really unlucky because the labor and delivery floor was really busy and they didn't want any students. It's not my clinical instructor's fault. It's not anybody's fault. It's just that we got unlucky. That's all it is. But everybody else in the program seemed to have been able to see deliveries. But for us, we were on the postpartum floor, so where the mom and baby go right after delivery, or like after a few hours after delivery, after they're stable, they come up here and we do like our postpartum assessment on the mom, helping the mom with like latching, so breastfeeding, and then looking at the baby. So we did a lot of like newborn assessments. We did a lot of baby baths, a lot of teaching on that floor, teaching especially new moms who really don't know anything and they're just anxious and they're looking up all the stuff on the internet. And so it's a lot of answering their questions, providing their reassurance, and just encouraging them that they're doing a good job. So that's a lot about what that course is. I love that placement and really had a lot of fun. And our final exam, again, clinical is pass and fail. Final exam is like a written exam with short answer, multiple choice, etc. Those kind of standard things. And then we have pathophysiology. Oh my gosh, that course was a nightmare and it was so bad. I'm so bad at memorizing different side effects and like symptoms of drugs. Just like all the drugs names are so similar to me, and anyways, it was a mess studying for that class, but I did okay. I did a lot better than I expected, which I'm really happy about, but still it was a struggle. And I think that term was so difficult because of this course and acute care, which is like med surge. Okay, anyways, back to this course. Weekly lectures, just about the pharmaceutical stuff, pharmacotherapy of common disease processes that you see across everything. And this is like the part 1 of the course. Part 2 we're going to take in second year. Yeah, there's nothing much I can say. Yeah, so that's pharm. Final exam, regular, standard, written things. Then we had intro to community health. So that is kind of like, we didn't have a placement for this. We have our placement in our second year for community, but this is kind of just like an introduction of community healthcare. So working in clinics, working in the community, working in those nonprofit stuff, things that you don't do inside a hospital. And we did a lot of like caring for people that have trauma, people of the LGBTQ community, people that are not as like, don't have a lot of money, they're not able to afford enough like the housing or the food that you need to really keep yourself healthy and well. How to connect with people who had bad experiences with the healthcare system, things like that. So I really enjoyed this course. We did a project and then we did a final exam. Standard written stuff, no placement. And then after my first rotation, so going back to the 3 different rotations, the confusing stuff, my second rotation, which was like kind of in the springtime, I went into introduction to acute care. For like adult care, medical, surgical, adult care. I was on a cardiovascular unit and I learned so much in that placement. I was kind of just like thrown in there, and then it was very overwhelming at first because it was so busy. Everyone was, running around. You have to do your assessment, you have to do your patient, like your meds, you have to talk to like the pharmacist, social worker, doctors. And then we had like 2-3 patients. You had to like prioritize your patients. In the beginning, of course, you start with 1, but then you eventually have to take on a little bit more because no nurses only take one patient each shift. That's just not realistic. So you have to learn about prioritizing your patients, time management, and then you have to learn about all those disease processes and those, what drugs you're giving, the side effects of the drugs, when should I not give those drugs. Like, it was just like, whoo, because in labor and delivery, it was just Tylenol and like pain management. That's literally it, because the patients are so stable. But here it's like patients come in with extensive medical history and you have like 10 drugs that you have to give them. And some of them have contraindications, and some of them you can't give, their blood pressure is too low. So then it's like so many things you have to really think about and use your critical thinking skill in that class. But I really, really enjoyed that clinical placement because I learned so much. I'm very, very grateful. My clinical instructor was absolutely amazing. She taught us so many things. So really great experience, but very intense. It was very intense. And the course itself was very straightforward. We really learned about like symptoms of diseases that commonly seen in adult care, the nursing interventions, and then like the orders from doctors that you would expect to give. We did a lot of case studies in the class, and our final exams kind of like that. You have multiple choice, you had your short answers, and you had your case study that you had to analyze. So really knowing what things to prioritize and what interventions to do with every problem, with whatever problem you're seeing. So being able to see like, oh, like their blood pressure is too high and then their temperature is too high. Like, what are some possible problems this patient might be experiencing, and then coming up with solutions. Again, having to do the nursing care plan. This one I did so bad on because I think I just didn't really, I was just so overwhelmed and didn't really know what was going on. I was just writing random stuff down at that point. Like, I learned a lot in this class, and it was definitely overwhelming, but very educational. Let's just say that. So that was it, right? Yeah, that was it for my winter term, and let's move on to the summer term. So summer term, very straightforward. Only 2 classes. Thank goodness, I needed a break. And one of the courses is a research course. So introduction to like nursing and research or something. Super, super nice professor. Like, the course was very straightforward, especially if you have experience in research. Even though I didn't, I still did. I think I did well in that class. Haven't gotten my final exam mark back yet, but I did well enough on the midterm that I'm confident I do well in this class. And yeah, it's very straightforward class, like weekly quizzes, final exam, midterm, all written, and it was like take home midterm, take home final, so you had like a week to answer 7 questions kind of thing. And then we had my 3rd and final rotation out of the 3, so I was in pediatrics and loved it. I think I found my home. Like, after I graduate, that's where I want to be. They're just so adorable. And we learned how to work with children of all ages. So from like a baby all the way to like a teenager. And then to do what assessments to do, how to really work with them, what kind of play they like to do, or like how to distract them, how to build that rapport, that relationship with them, how to interact with the parents, because parents are a huge part of their lives, huge part of their care. And yeah, just like, and also advocating for the little ones that like can really speak and tell you where it hurts, right? So again, clinical, pass or fail. The course itself, the lectures, loved my professor, very straightforward, very to the point, similar to adult care. It's like, oh, like these are the symptoms you watch out for, these are the nursing interventions you do. And then we did like case studies every single class after lecture. And then final exam, same thing, multiple choice, short answer, case study. And then nursing care plan, again, this one's a little bit easier because it was more or less just like a huge table that you fill out instead of like a essay. And I did a lot better in this format. I just can't write. Like, I'm really bad at writing, but like when it comes to bullet points, I'm pretty good at that. I think that's it. Haven't gotten my marks back yet for the summer term, but I think I did okay. Overall, I'm confident. Passed all my clinicals, so that's good. And yeah, I'm super excited to move on to next year, and I cannot believe I am almost done and need to start studying for the NCLEX. And I will try to make more videos about the program to give you guys more insight. Sorry, I know I literally made 1 video for the whole year. That is my bad. I will make more. Comment down below if there's anything you want me to add, anything you want me to cover, or anything else. Oh, I was thinking of making a video about my admission story, or like reading out my personal statement, kind of, just to give you an idea of what to write, or give you some pointers if you're ever applying to this program. Let me know if that would be helpful, something that you want to see. And that's it. Thank you guys so much for watching. Hope this video was helpful somewhat, and I will insert a picture of my Google Calendar of a typical week for all 3 terms right now. And that's it. Thank you guys so much, and hope you have a great day. See you soon.